On this Mental Health Monday, we're looking at new data released from the Centers for Disease Control concerning some disturbing information on suicide.
TJ Anthony joining us live in studio this morning with more on a topic that is sometimes hard to discuss, but one that can save lives. TJ.
Good morning. So people are often reluctant to talk about suicide, but experts say actually being open and talking about it is one of the first steps toward turning around a troubling trend. Now, new data from the CDC released this month shows an increase in suicide deaths in each one of the past 2 years. One of the experts behind the data calls the trend that deserves urgent attention.
Kind of ran into his body. You know, I had no idea it was there. And so I took him off of what you would have thought was a noose, but it wasn't. It was a 500-foot repelling rope that he had from boot camp.
A husband, father, and veteran, he was Robert James II. Kyle James looks back on the past and wonders what could have been done differently with her husband.
When I do think about it, I always feel like I played a part. And I think that's human to feel that way.
This month, Georgia-based Centers for Disease Control released numbers showing while suicide declined in 2019 and 2020, the United States saw an increase of about 5% in 2021. In 2022, it increased more from a little over 48,000 suicides to nearly 50,000 deaths. Even though the number has grown, there is still hope.
I think suicide, it absolutely can be preventable.
In a statement, CDC's Chief Medical Officer, Deborah Owery, says the troubling increase in suicides requires immediate action across our society to address the staggering loss of life from tragedies that are preventable. James is now a nationally certified addiction counselor at Piedmont's Behavioral Health Outpatient Program. Now, she wants to tell her story in order to provide some help and clarity to others.
Wish my husband had heard someone else say, you know what, you're not crazy. You know, you should feel the way that you do.
The National Action Alliance for Suicide Prevention and the 988 Suicide and Crisis Lifeline suggest some steps to help you or a loved one who's at risk of suicide. Some include asking. Talking about it, they say, may reduce the suicide ideation. Also, help keep them safe. Reduce the suicidal person's access to ways they could actually harm themselves, like removing or securing any weapons. Also, help them connect to a suicide prevention service and follow up.
Powerful story there with some startling statistics, TJ. I'm curious, what are some resources for people who have questions about suicide for themselves or perhaps a loved one?
So, Frederick, there are some resources right here in Central Georgia. So Piedmont-Macon actually allows people to walk in their doors free of charge and get an evaluation. And of course, now there is the National Suicide Hotline number. So all you have to do is call 988 and they can help you out and also get you in touch with resources closer to home. And of course, the important thing is don't think it's just a phase or that it'll get better. Just take it seriously and get help.